Coastal Cancer Center is a community oncology practice in coastal South Carolina. Our mission is to provide high-quality cancer care for patients close to home. The patient-centered care delivered in community oncology practices is really the ideal way to receive treatment. The staff gets to know the patients on a personal level. We have all the services under one building. Our pharmacy is just down the hall. We have imaging services, so the patients can literally get everything they need for their cancer treatment close to home.
How are you? Oh, it's so good to see you.
It's even better to see you.
The physicians here, they're dedicated to their patients. Every decision that is made in this practice is made by a board of physicians, so they do not have an administrative supervisor telling them how to treat their patients.
If I feel like I need to see a patient and take longer with the patient, I have that time. If I feel like I need to see him for a longer period of time, I schedule him that way.
It's a hard thing when you have a cancer diagnosis come your way. So you want to see them do well. They're coming in, they're seeing the same people week after week. The locals are treating you, but we live here. Our families are here. So we understand. We understand the culture. We understand the hardships.
Everyone is an angel here. Thank you. It's a train out, right?
I feel like that's one of the big things about Coastal Cancer Center is that you see that happening as a whole in our group. It's somebody's mother, it's somebody's father, somebody's child, somebody's friend. And that's how we treat them.
Considering the entire patient, it's really important to deliver effective cancer care. At Coastal Cancer Center, we've made an effort to create a welcoming, warm environment in which patients can receive their treatments. Every person is different and they have different priorities. And knowing what those priorities are for your patient is incredibly important in creating a care plan. You have to understand what the patient's limitations are. Can they travel to the office? What do they do for work? What are their personal preferences? If I prescribe a treatment and the patient can't get to the office 3 days a week for it, they're not going to receive the treatment, and that's not going to be effective care.
Another advantage to community oncology is that you have continuity of care. Do they need a scan today? Because I can tell you if one of my patients walks in with a new onset shortness of breath, I have the ability to send them across the hall to get a CT scan right now because it's right here. We have the pharmacy and it's down the hall. It's not another stop, let me think about how I'm going to get this done. We help with that.
I think it helps with their comfort level with their treatment. So if a patient doesn't buy in to the plan, then the plan's not going to work. So in our situation, it's not us telling the patient this is what you have to do. It's a group effort. They're part of the treatment process. They're decision makers in the treatment process. Also, if we have a patient who's having issues affording medication, we're going to go ahead and ask them, is this an issue? These are our options that we can help you with.
Without somebody like Eric there, something like this would be impossible for me to do. When you have things like that taken care of, that's huge. It was just good to me.
Well, there you go. Thanks, sir. If you need anything, be sure to let us know.
When you can come in here and the people are pleasant to you, you just have to experience something like this to realize how significant all those little things are. Those little things add up to making the difference.